Like,
He fired his wife.
yeah.
Wow. I'm gonna record this just
Yeah,
for training. This call may be recorded for training purposes.
yeah.
So Anna came
So
over, and the
Anna,
male dentist fired the wife administrator.
his wife administrator, yeah.
Oh
Yeah.
wow.
She's like, I can't be around this anymore. So you
And
can record this. Don't share it with them.
yeah, no,
One
yeah,
office. It's
yeah.
a Runner Park, Maryland.
Love it, love it.
So then there's Emma, who has not started yet. Emma's going to be a sterile tech, who we're hoping to
Hannah.
go. Anna, and then the second one is
Hannah.
Emma.
Okay.
No,
Not to be
Anna.
confused.
Right, Anna and Emma.
Oh, Emma.
Yeah.
And you already had Kayla as a sterile tech.
Yes, Kayla is 1 foot into college, 1 foot with us.
Yes.
She's moving on as a sterile tech.
Got it.
Emma is a sterile tech who we are hoping to fast track into assisting.
And how'd you find her,
Indeed.
and why? Where was she before, and why did she leave?
You know, Food Line, grocery store.
Okay.
Yeah,
and she wants to get into dentistry then.
Yeah, funny. We actually interviewed her for the front office.
Yeah.
You know, when you post for an assistant, you get maybe 2 resumes.
Yeah.
Post for upfront, you get 300.
Mm-hmm.
You know, so she posted for upfront. 1 working day interview. By lunchtime, she said, I'm really kind of sitting here. I'm not used to sitting. I'm used to roaming the grocery aisles. And like,
strengths.
Great.
Love it.
You want to move? Like, you wanna
so good.
move around? Like using your hands? We've got the thing for you.
Love it.
How do you feel about blood?
How do you feel about wearing gloves and masks, right?
Yeah.
Oh man, that's so good.
So yeah, she loved the second half of the day. She came back for another full day. And so here we are.
Okay.
Last time you and I spent, I think, the whole time talking about 1 assistant.
Yes, we did.
Leslie. And I called it a coming to Jesus, and you called it a critical conversation.
Crucial conversation.
Yeah, sure. It seemed critical to me.
Okay.
If you want your job, this is critical.
And this is with Leslie.
This is with Leslie.
She wanted to work through lunch, and Leslie took advantage. Yeah, she's kind of taking advantage of Stephanie. She's kind of going rogue. And I said, Leslie, not a good fit. Come to Jesus meeting, crucial conversations. All right, so let's follow up with that. How'd that go?
It went really well. It became very quickly, you know, I talked to the other assistants, and there's a lot more tension there than I realized. So we talked as a group. Oh, when we talked to the other assistants, by the way, they were like, yeah, you know, Leslie this and Leslie that. I'm like, you know, we're meeting to talk about you and how you're going to deal with Leslie and how you are going to be a better teacher and how we are all going to work as a team. So we met as a group, and it was like, hash it out as a team, and so far so good. So we kind of set boundaries, like, all right, Leslie, here's when you come, here's when you leave. Here's what we expect. So far so
we call
good.
we call those not rules but agreements, right? Remember we said agreements. Okay, good. Love it.
Yeah.
So good. All right, I'm proud of you. That's awesome.
So far so good.
And when so far was how long ago?
Well, I guess 3 weeks ago.
Oh, good. All right, that's awesome. You went right for it right after our meeting. I love it.
Yeah, it was crucial.
It was crucial.
It was critical.
Okay. It was a critical. All right, and number 2 was Emily has gotten a lot more quiet and disengaged, recommending, hey, okay, one-on-ones.
Yeah.
And I recommended put an ad out.
Oh, I forgot. Yeah, you did say that. But and so she has a timetable. She's hoping to go to school. So, you know, I kept trying to talk to her lately this last month. We had a one-on-one, and it was okay. She did open up a little bit, and so Eric, she did this like, well, you know, if I talk, you say I'm arguing with you, and if I don't talk, I'm not engaged. So, therefore, I'm not going to do either. And it's like, no, you know, it seemed very immature to me. Like, you know, you're allowed to be engaged without being argumentative. So I think she just has a lot of personal stuff going on. But we're trying to
listen. People work together all the time without being argumentative and being engaged.
Right.
What is it about us that makes that difference?
Right.
It's not. And look, do other people have that same problem with you? What's the common denominator here? Right.
Yeah.
So
no one else is having this problem.
You can't exactly. You can't. I don't know how to say this without being negative, but some people just need. Let me say it this way: some people need time to wake up and see the light. You know, she's still seeing she's still seeing the number. She hasn't seen the matrix yet, or whatever. You know, she's not taking the blue pill or whatever. So, one-on-ones will help her, but probably won't help her fully until she's long gone and realizes it later on. That would be a guess. At her age and where she's going. If she was staying with you and not going to school or whatever, then that would be different. But I would not give up on her. I would continue to find a way to make that work. My coach, you know, where we see, you know, I'll say, I see argument, I see lack of engagement. He says, I see somebody who's struggling to figure out their strengths in this workplace.
You would say that to
us Emily, as we're talking about this. Yeah. So here's the 5 questions that people are asking, but they're not saying them out loud. Okay. And I think we're doing really well with answering these 5 questions, by the way. Okay. So what do they believe around here? What's the mission vision? We've talked about this and sharing that with the team. Is there clear culture? We spent a lot of time on culture with this team and sharing that with them before we even started working with them. So what do they believe around here? This is what Anna and Emma are going to be thinking over the next 6 months continuously, by the way. Okay. And this is probably what Emily is thinking about as you hear these questions unfold. What's my role? Do I have clarity in my role? Emma quickly pointed out, because the 3rd question is, what are my strengths? If this is my role and these are my strengths, she went, no. And you guys went, yep, put it right here. That was perfect. Okay. That was really good. Who are my partners in this? What's my team look like? Right? What's my team look like? And lastly, what's my future? When you think about your one-on-ones with people, you're clarifying these 5 questions continuously, repetitively.
Can I make sure I didn't miss a question because I have 4 of them? What are the first 2?
What do they believe around here? What's my role? And this is where they get combined. Number 3, what's my strengths? What's my role? What's my strengths? Those are 2 different questions. Yeah, that's probably where you got 4. Who are my partners in this? How am I a team, right? Who can I count on? Who's got gossiping? Who's negative towards me, right? They're evaluating their social place on the team. And then and then what's my future?
How do we start to explore these questions? How do I
So Lynn's my team member, right? And I sit down with Lynn on a one-on-one and I go, Lynn, I want to make sure that we're clear on who we are here and what we believe around here. And so I want to review our mission quickly with you, and I'll do this every time we meet, okay? So today I just want to focus on 2 of our core values, our culture elements. Boom, boom. We'll review 2 more next time. You're just constantly going through those, okay? Then you say, you know, your role here as a hygienist is essential to us making sure that the doctor's set up for case acceptance. You have a better, stronger connection with the patients all the time. How do you feel about, and don't answer, Lynn, but how would you say your role is? Do you connect with that role? Then I'd say strengths. What do you think your strengths are, Lynn? Here's what I see. And then I'd let her lead that one. Then I would follow it with strengths. And then I would go to, who are you connecting with on the team? Who are your partners when you're here, right? Who are you connecting with on the team? How's that working out? And then lastly, your future. Here's what I see us working towards. We're going to be a dynamic duo, Lynn, on case acceptance and getting people healthier. You're going to set me up. I'm going to knock them down. And here's how we're going to do that. What do you think? How do you see that happening? How can I support you in doing that? Does that make sense?
Yeah.
Okay. Just shooting from the hip, but you know, you can, with each team member, do something a little bit different. Lynn's a fast talker. I'm a fast talker. We move pretty quick through that. If I had
one-on-one style.
Yeah. If I had Amy, Amy would be a little bit different. Amy would be, man, you were wise beyond your years. Share with me what's going on. You know, how do you think we're aligning with our mission and our vision? What do you think?
Yeah.
Let her talk. She loves that ability to be a part of it. You know what I mean? So,
yeah.
Okay.
You're You mean you're saying that specifically about Amy
Mm-hmm.
from your interactions with her?
Mm-hmm.
I'm impressed.
Is it right though?
Dead on.
Yeah, she loves the feeling of we're lifting this up together. This is not you telling me what to do. I'm partnering with you.
We had a lot of friction the first 6 months because it's like, no, you're hired to be answering the phone and to learn from me. And you stated you don't want to be a manager. You stated you don't want to be a manager. And she's like, I don't want to be an integral part of this. This is my next career. But her energy couldn't stay away from it. You're dead on. And now, Eric,
yep,
Emily is taking a less engaged role and Amy's doing everything. Amy is just. Can I tell you one more thing about Emily?
Please.
Because I'm curious what you hear. After or maybe during that one-on-one where it's like, well, not engaged enough and too argumentative, so I'm going to be nothing. We kind of have a group list, shared list of tasks. Like, hey, you wear this hat, hey, you're in charge of IT.
Your bubbles overlap on
right.
Yep.
You czar, we call them hats. Anyway, so hey, there's one really important task, Emily, that we've been working on, and your due date was like July. It looks like we checked back in August, September, October. Hasn't been done yet. And the next thing out was just kind of some excuses like, well, you're not available. We haven't done it. And no. So I
remember her saying, you're never available to do the one-on-ones. I remember yeah.
And this one's for like insurance credentialing. Just got to log in and submit the paperwork.
Yep.
It's a lot of work, but we've been talking about it for months.
Okay.
Anyway, I just took it away from her, and I think my words were something like, okay, I'll do it. That's it. I'm sorry. I'm disappointed we haven't done it yet. I'll take care of it.
Okay. And 2 calls ago in South Carolina, Dr. M was going, I don't understand. Why aren't they doing it? We've talked about it. Why aren't they doing it? And frustration. I don't want to go in tomorrow, So, and Lynn just saw their numbers and we all went, wow, that's what we were talking about when you came in, because I shared their numbers. Wow. I mean, it's not that they can't produce. It's not like you can't produce. It's just, why aren't we doing these things? And I shared with them, one of my other coaches said this to me. I loved it. Over informed, under transformed. We pour into information. We love training. We get ideas from other people, but we don't change what we're doing. Or we listen to what my boss says, but I don't do something different.
Yeah.
And there's 3 reasons why that happens. 3 types of employees: engaged, disengaged, neutral. And right now, Emily is disengaged. Neutral is she wouldn't even be showing up on your radar. Amy is engaged.
Yeah.
So defiance, disagreement, contradiction, obvious contradiction is disengagement. When you don't even notice it's not happening, that's neutral. And when you see people shining, that's engaged. I call that engaged is ownership mentality. And you'll hear me say that with the team. And when we do the 2-day seminar, you hear me talk about together which means more and having ownership and vision of the practice and all of that. But the ownership mentality is key, and not everybody has it. And some people have it for a while, then they don't have it. Emily is an example of that. She had it and then she lost it, and something happened. Something switched. We don't really know what that is, really, do we?
I think it's that she decided now that she's on a path to go to school. I think it's that
short timers. Okay.
As soon as she signed up to go to school, she realized it's not her strength. I think it's a personal crisis, but I keep begging for any clue that it's something in our office, something I could control, I could help with, and I just don't think it's that.
If it was something in your office, Amy would be having a problem.
Yeah. Yeah. And in addition to what you're saying, asking Amy, what's going on with Emily? And Amy's like, I have no idea. It must be at home. So
that's unfortunate.
Yeah.
Does she have go ahead.
Go ahead.
Well, does she have a deadline of when she's not going to be working for you?
So she's hoping to be into hygiene school in the fall, but it's not sure.
She won't find out till March if she's in hygiene school. or April, May.
Later. I assumed it's the summer. I don't know.
Yeah, probably.
So here's a problem for us is, well, we don't want you to go, but of course we want you to soar.
Yeah.
And so Emily, I can only assume that you're going to kick ass in this world. And I assume therefore you're going to be out of here in the fall. Now, if you're not, of course we'll try our hardest to make room for you and keep you here. We'll do everything we can to have you here. But for now, we're just going to assume that you're out of here in the fall.
Mm-hmm. Yeah. And I'm actually glad that she's open and honest with you about that communication. There's nothing worse than being surprised. And so mutually respectfully, you would say, wow, let's keep communicating about this, because I really appreciate you keeping the heads up. You've done me a really, really big favor by not surprising me with this.
Yes, but she can't not surprise me, because she, in addition to this, I don't really care. Here's what you hear. But first it's like, well, I want to go back to school. Okay, great. Well, that means I need to leave an hour and a half early. Okay, when? Well, 4 days out of 5.
Every day?
Yeah, okay. Well, I support you and everything you do, therefore we'll make it work.
So she had to tell you, yeah.
And then coming back like this week, hey, I know I'm supposed to shadow you. Once a week we have a thing where we shadow, the front office should be shadowing back office to see. She said, well, I know I'm supposed to be shadowing you on Tuesdays, but I'm wondering, could I shadow hygiene instead?
Mm-hmm.
Okay. Is this for the team or is this for you?
Mm-hmm.
She's like, it's for me. Okay. Yes, I agree.
Mm.
Are we benefiting as a team for this? Or is this for you?
Yeah, Lynn and I are both going, no, that's a great question. It's a great leadership question. What'd she say?
She's upfront. She's like, this is for me. This is all for me. I'm like, okay. And I know, just kind of put in the back pocket, like, okay, I might someday call on a favor. Some Godfather line in there.
Yeah.
Someday I might call you. Remember.
Oh, how did the team do after the team meeting? I know you sent me some text message. Hey, I'm here. I'm talking about knowledge isn't power. It's only if you put it in action. And then Amy sent me something that was like, fire me up. I shared it with the team. Lynn got a screenshot of your text. I'm like, hey, first team meeting, and they're enjoying it. But did it stick? Did you hear any backlash? Was there any other follow-up I should be aware of?
Hey, Eric, who's the one person that didn't show up?
Emily. She was sick.
Emily did not show up. And she texted me, hey, where are you? Are you okay? Texted me, oh, you said it's optional. Oh, boy. Anyways, everything was great. It was fun. I don't need to tell you, everyone was really enjoying.
I got to tell you, I don't know. I was looking at who's the hygienist straight across from me, next to the guy. Next to the guy who was right across from me.
The one that said maybe she had 20 years of experience. It's Tammy.
Okay.
Now, deep in your notes, maybe 6 months ago, so Tammy and I got some friction.
Mm-hmm.
We're just different personalities. We don't see facts the same way. You could say something's red and she's like, I thought it was blue. Okay. Opposite
sorter going on there.
But why do you bring up Tammy?
I mean, not physically, but I'm going to see how this goes she was engaged. I was calling on her. I mean, I was like, and I couldn't see everybody as well as I could see her, but everybody else was really quiet, and she was engaged, but almost from a hesitant standpoint, which is totally understandable. It's first team meeting. I can see Amy over there going, I'm going to let them get there on their own. They're going to see, and she was holding herself back that way. But I didn't know, I hung up the phone. I was like, well, I hope they like that. Did I text you for an answer, or did you just send me that unsolicited?
No, you'd be fishing. No, you didn't do that.
Oh, okay.
I texted you, and and then Amy and I met in the hallway, and like, I already texted him. Oh, me too.
Love it. So reports. We're going to do more of that. Yeah. Now, hear this. The first meeting is set at a bar to get them engaged. They're not all going to be at that level. And I don't tell the team that. I tell you that because there's an awakening that occurs when you talk about confidence and self-esteem and why we do what we do and why are we on a growth pattern. And it's inspirational, hopefully, not motivational. Hopefully it's inspirational. And they won't all be that way, but I might reflect back to that. Hey, remember why we said we're doing this? So hopefully we have a leader for everything. Remind me, we need to have a leader for everything. We did that well with the admin team on the great call process. And now we've got to get leaders for everything as we move through this all team training, right? Do you want them? Did they already do the disc? I can't remember where we left it off with everybody. Did just admin do disc?
They all did.
They all did it. Okay, perfect. So when we get there, you just go, Eric, we've got disc. We've already got it down. Okay, cool. Love it. So we'll keep on that path if that's okay.
Yeah.
Okay.
Yeah.
We'll probably do a mix of like great call process, but the admin's already really had that. So I'm just going to talk about it from maybe a clinical standpoint on why it's important. Does anybody clinical answer the phone?
No.
Okay. So we'll talk about law of research. So nobody walks in and says, so what brings you in today? They walk in and say, oh, I see Amy talked to you on the phone. She told me that, ... And that's how we'll touch on that. Okay.
Yeah. Since you bring this up, I was not going to bring this up, but I do not want to interrupt the path. Mm-hmm. And you've told me a couple times, you normally have like the 3.
That's okay.
Disc, strength finder,
and emotional intelligence. That's for you right now, team leader. Yeah.
Right now we are swamped with broken appointments.
Okay.
Hygiene broken appointments. Maybe we might see that in the numbers in a minute.
Okay.
But there's been some talk among Amy and Emily and I, like, hey, reason for return. When that comes up, that'd be great.
Let's do it. Okay.
I don't want to disrupt the flow.
Yeah, let's do it. We leapfrog things all the time. What you're going to find is that is a good patch, and we're going to do the crown process after the patch. Then we're going to go through and really save the tooth. Okay. So we're going to do reason for return, reservation on appointment, those sorts of things. And then we're going to go back to over here psychology, eliminate limiting terms, permission statements. Those are the things that really you spend time with this patient, connect and make this relationship and have people buy in. But in the meantime, we'll do some little hacks that work to help prevent cancellations. Now, if your hygienist starts saying these things chairside today, when are you going to see the cancellation stop? Right?
6 months.
Okay. So it's going to be continuous, doing these things while we stack and add things on top of it. And maybe we need to focus on the bite because we keep breaking this tooth, but we're going to do the equilibration. That's maybe a better example, right? This will be a splint for now. We'll do the equilibration later. All right. Sounds good. We're going to do that. I got notes for the team meeting. We got an action plan for next call. And I will do law of research. Clinical teams, what you say when you walk in after you get the great call sheet. I'll emphasize that, but then I'll jump into cancellation prevention stuff. I think sometimes clinical team members see it as, hey, Emily, hey, Amy, when you answer the phone, don't let them cancel, okay? And that's not where I'm coming from. I'm coming from, how do we talk clinically to prevent the person from ever picking up the phone? Lynn, is that okay? Thumbs up, Lynn. Is that good? Okay. Lynn says yes. Okay. As a hygienist, she knows. All right. So we'll do, reason for return, reservation on appointment, be the massage therapist and the chiropractor, and atomic habits. Those are the 4 things we'll cover on prevention. And 95-5 rule, actually. We're going to get into that. Is that okay?
Yeah. I think I say the words 95-5 probably once an hour in the office.
Love it. Good. All right. He's already been saying this. Okay, cool. Yeah. So I will just give my 2 cents into it. All right. Should we look at numbers, or is there more team? Good for numbers? Okay.
Yeah, I think team's good.
Okay. If something pops in your head, just let me know.
Oh, new associate.
Dr. Dye.
Dr. Patricia.
Dr. Patricia. How's that going?
This is being recorded.
This is for internal use only.
A personality, attitude, openness to learn, A+, all fronts.
Okay, attitude, A+.
Willingness to learn, personality, great.
Okay.
Eric, she's been a dentist in Brazil. She was a dentist for 4.5 years.
I can see where this is going.
Yeah, she has the clinical experience of straight out of school.
Yeah. Yes, 100%.
Straight out of school.
I have an assistant from working in an office. Where is she from? Iraq or Iran? I'm not sure which. And she only did composites. That's all she did. So, yeah. She's just an assistant now. She's trying to go to hygiene school, if that tells you anything. So anytime we get international, there's got to be a lot of CE that's been going on to get them there. So what are your thoughts then?
I told her today, it just happens we had a one-on-one today. And I said, listen, I'll be honest, my expectations are here. You have a different skill set, but for our model, you're here now. And therefore, my expectation for you is you're going to have you're on the fast pass for learning. It's going to be very intense. It may be frustrating at times. That's okay. It may be overwhelming at times. Please let me know when it is, and we'll just slow it down a little bit too. And I told her, your personality is fantastic. Your openness to learn is amazing. Your attitude's fantastic. You're going to do very, very well. But we're on the fast pass to learn right now. And so like,
Yeah. How did she respond to that?
She's great. She is very open. She's like, good. I want to hear. I want to learn. I want to, and I'm like, you have skills. You have a lot of skills, but it's different for our model. And we're just going to morph these skills and yeah.
Okay. Keep doing your one-on-ones with her more frequently than you probably think you ought to with her new right now.
Yep.
Do treatment planning, masterminding with her. Look at x-rays with her, look at her charts, look at her treatment planning, ask why she's doing what she's doing. What are you seeing that she's not seeing? Ask permission to show her what you're seeing. And it sounds like she'll say yes, that would be great.
Can I tell you, like on the spectrum of what an associate could be, she's the opposite of the worst nightmare, which is like, oh, just doing shit and never telling anybody. She's the opposite. Every single patient she sees that's emergent, she pulls me aside to be like, hey, I need to know what you think. and like, okay. And like, sometimes it's like, oh, that's like, that's a tongue, like, which is good. I'd rather her check in. But right now she's worried about this much. And I'm like, in life, you just need to worry here. We're going to get the scope down.
Yeah. Good coaching. Small ladder rungs, not big ladder rungs, right?
Yeah.
Small spaces in between. You're probably going to profile as a CS personality type in DISC who needs a lot of details and hand holding, and that'll help you see her from that perspective. And we'll figure out strengths with Strength Finder later on that. Okay. Got it. All right.
We're going to have some low numbers, my friend.
All right. Let's take a look here.
As we go with Dr. Patricia. But I punched some numbers already too. She's not awful.
Oh, what is that? Uh-oh is right. Somebody touched something they weren't supposed to. Who's doing this? You?
No.
Who's filling this thing out?
Yeah, time for this thing?
Yeah, I know. Who's doing this? Oh, shoot. I wish I would have seen this before so I could have fixed this and sent them back a copy. Doesn't do me a lot of good to fix this right now. Lynn, if you get any clients or coaches that are watching this happens to, you're going to probably need me to fix it. What typically happens is somebody cut and paste something, and you can't cut and paste the tracker. So let me figure out. Looks like I got to go fix something in August. So let me go real quick, see how fast I can do this. Yeah. So I think what happened before was, I think this happened before, and she didn't use my copy because she added I can see what she did. She tried to make more rows instead of just, see how she's skipping when days aren't here? You just need this needs to be up here. You see that?
Okay.
So is Amy doing this?
Yes.
Yeah. Give her some coaching. Say, look, don't skip lines. I know she's doing that because she's collecting on days where there's no production. What she's going to do instead is put it over here or something. Just put those, it doesn't matter. It's all going to add up the same. And what that is just mail collections. She can just start over because she's never going to have enough days in the month to fit everything. You see what I'm saying?
Okay. Yeah. Okay. I see it now. So I'm sorry. Say it one more time.
I'm going to go like this. I'm going to take that number because this is why she skipped this line, right? Because she put it there. And then I'm going to get rid of this number here. And then I'm going to delete the row that she put in. Yeah, I don't even know if I can fix this. We'll see.
Thanks.
Yeah. Once you start inputting some stuff, it really starts going, what are you doing? Let's see.
So she tried to make new lines, I guess, right?
She tried to input some lines when she doesn't need to. She just needs to stack data. A miracle worker. What just happened? You gotta be kidding me. I am not that good at Excel. What's her email address? Direct to her.
Atlantic.
Mm-mm.
Here.
I don't have that.
Yeah. You could email the office. She'll get it.
What is it?
Bay Hills.
Got it. Amy. I'll put doctor has instructions on tracker for you.
I half understand.
Yeah, basically
don't insert new lines. So what do we do when we get collections on Saturday, Sunday?
Put them just in that next column over, or just add it to Fridays. Just make Friday look bigger. It doesn't matter. Okay. It's not a per day thing. Okay, I made it nice. I said thanks. Okay, sent that. Hopefully she's not too far into November and therefore doesn't have too much to redo in November. She could probably look at hers and just look. You can't cut and paste. You can't insert rows. Can't move anything around. You can just insert data. That's the only way to work. Okay. All right. So let's see. You said it wasn't great in October.
It's not great, but also, okay. Yeah.
That didn't work. Okay. So October, we always read this right to left. Okay. So yeah, 847,000 adjustments. We've talked about this. This is the, hey, we're billing this, but we know it's to collect this. You're good with it. It's about 55% write-off rate, but that's kind of fake money. We've already talked about this.
Yep.
All right. And really we're focused on collections. That's our number. And 171 a month, and it was down to 126. Now the reason it's down is the last 5 months it's been down. Well, not really. 4 months, really.
When did we start, you and me?
Yeah, I was just going to say, when did you start coaching?
You should be paying me, man.
What's going on here? All right, let's look at this. 138 last 4 months, and prior to that, it was 193.
Lynn, help us, please.
Yeah,
Lynn.
We need a new coach, Lynn. Okay, let's just compare apples to apples. So hygiene was doing 53, and now it's doing 32. How can we produce $84 a patient? What's going on? That's like impossible. Something ain't right. 420 patients in 322 hours. That's not right.
Is it referencing you?
Yeah, something's off there. I think she added a row here. Yeah.
I mean, that's not possible. 84.
It's so low. I know why. Because look, she's putting negative production in there at the beginning. Yeah, which is making the daily and she's moving things down, which is making daily average look like she's producing $381 a day. Producing $20 a day, it's impossible. This is the problem with open dental and looking at that number and putting in negatives. I'd rather just put those numbers in write-offs if we need to. I don't know, how can someone produce $195 a month?
I hear you.
And something's off, right? So right. I'm not gonna pay it too much attention. But we started tracking differently.
I want to go back to net production.
Yeah, well, we could do it either way. We're just gonna be consistent. What happened was we were tracking a certain way, and then we started tracking differently.
Right.
And so it made it look like production got cut in half.
Yeah.
We can keep it the same. I don't care. We can keep producing the big number as long as we show the write-offs over and write-offs, not as hey, you suck today. You produced negative 300 and she saw 8 patients. It can't be on a production level, even though Open Dental does that. You can't.
Can you go back to those negative numbers again?
Mm-hmm. Yeah.
So that's the month.
And she added a row, which threw everything off. So it's kind of compounded here, but she won't do that.
And if you scroll up, what's like RST? The new page. Okay, so production.
Yeah.
So, it's because it's Kelly. there's only one reason that's negative, because she's not working.
Yeah. She worked one day.
Right.
But she produced 763 a day, not 2063.
Yeah. Okay.
Right. That's impossible. And that's why the production patient is going to look the way it is. It's just how you guys are tracking it. It's not a real number. Yeah, so she's worth, and same thing. I mean, everything's happening to the other ones. And so it's bringing that down. It's going to average it. It's going to average it well, 669. It's going to average that out. That's fine. But when somebody only works one day and they have all these negative things from prior things that they're writing off, it just throws it way off. Okay. So I'm not too worried about it. It's just, it looks like at some point you guys start tracking it differently. Yep. Right about there in June. And so I don't know how you want to track it with Open Dental. You either need to make it net production and not do adjustments, or you need to do gross production and do adjustments. You can't do both. Right now she's doing both. She's doing, it's like a double whammy to the producer.
I mean, I'll be honest, I'm still learning a lot from this.
Yeah.
And one thing I'm looking for is like, what of all this info, what are the hits? And we don't need to dive into it today, but like, if I'm not going to do this to you, but if I said, okay, Eric, I'm going to cut out half of these numbers, like you're going to a remote island and you're only bringing half of these numbers with you, which are the ones that are coming? And so obviously we'd stick to gross production, because that's been proven.
Yeah, I
see that today you already jumped into, you want to see hygiene production, right? You want to see.
Yeah, I mean, look, if I'm just going to look for a few numbers, it's going to be production per patient, production per hour, open time, and perio.
Okay.
That's all I want to look at. The last call Lynn and I were on, he goes, what should I be producing per day? What should each provider do? I can't even do it per day. I can do it per patient per hour. Hygiene should be 175 per patient, 175 per hour, because we should see one patient an hour.
You'd be watching production per patient, and hygiene per hour.
It's production per patient. This is for any provider. Production per patient, production per hour. In hygiene, that number is 175 for both. And in doctor, it's 500 for both. And when you guys are doing gross production, you're at 197. Then we write off a lot of that. Right. 110. So insurance is creating a problem for you from a financial standpoint. I know you've looked at hygiene as a loss leader. It doesn't have to be. Okay. The last office, 2 offices ago, we're looking at it, they were at 220 a patient, 220 an hour, I think, Lynn, whatever it was, but their perio was at 50%. And it's a real perio program going on in that hygiene department. So right now you're looking at hygiene like, hey, see my patients, present treatment so I can go over here and do real dentistry. I think that's kind of how you've looked at it. And I think that's okay. It's just, I have standards to hit, and I want you to be able to afford to pay your hygienists, because they're going to ask for raises every year. I would also look at perio and say, all right, we're at 16%. We could be at 30 if we had something going on there with perio focus. Maybe that's what it is, because everybody's healthy. I don't know. I see a spike in cancellations and open time. I see a volume-based department that can be both volume and high quality.
Yeah.
So I think we're missing out on some opportunity there. And so, things look like they went way down, but I think it's how we were tracking it. I think it's the same. And the reason I know that is when we looked at your numbers and went, oh, what's going on here? Why did that happen? We went from 205 down to 102 because we're double dipping the write-off.
Right.
And
I mean, and we could fix those numbers in 2 seconds by running a monthly report and just plugging them directly
right here. Just boom, 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 right here. Just fix it on the yearly summary, and I'm totally fine with it. Yes. I won't be able to differentiate you and Dr. Dye and Dr. Lee.
Bao, yeah.
What? She's on maternity leave, right?
Yeah.
Yeah. What's your associate's name is on maternity leave? Dr.
Bao, Sarah Bao.
Oh, Bao. That's right. BAO. When you said it, I was like, I didn't hear it right. Yeah, Dr. Bao. That's right. How's she doing, by the way?
She's good. She needs to come back. I don't care if she needs to come back.
She's too good. She needs to come back. Okay. So baby's healthy. Everybody's good?
Baby's healthy. she had a C-section and now she's having hand pain, which means like she's probably not coming back when we, originally thought. Plus, my wife looks like she's coming early.
Oh, really?
We're due, and so my wife looks. So it's like, okay, Patricia,
hurry back. Oh no. Ooh, what's your due date again?
What's that?
What's your wife's due date?
It's supposed to be December 3rd.
Wow, we're on the home stretch here.
I know. If we could do it right now, if you had a way to do this right now, we would do it. I mean, it's absurd.
Wow. Why is she having hand pain? Nerve damage from the surgery or something?
She's guessing it's from nursing and just holding the guy for very fixed.
Yeah. Is this her first baby?
Yeah.
Okay.
If I'm going backwards, I'm fixing the yearly summary, but I can also fix per doctor too, so they're not messed up.
You're playing with the tracker right now?
No. I'm just making notes so I can come back later.
Got it. Yeah. Yeah, you can fix it here. Yeah, you can fix it right here. Make sure that we're just apples to apples on this stuff. And either you go January through May and lower it, or you go June through October and raise it. And the question would be, does the adjustments maintain the same? Because here early on, we were writing off 89. I think that's pretty, and then now we're writing off 79. So I think it's pretty consistent.
So, because, all right. Yeah, I need to fix this. So we're talking about the same thing.
Yeah.
I'm going to fix that.
Open dental is very confusing. I got to tell you, just so you know, not many softwares do it like that. There's just one type of write-off. There's not an adjustment and a write-off. Most softwares just have, hey, make an adjustment, and then you decide what adjustment type it is. And there could be 10 different adjustment types. For some reason, they go, here's your production. Here's an adjustment. Here's your net production. Here's a write-off from the ledger. And why they don't make those both, they're both reducing production, right? I don't know why they do that, and it creates confusion for people who are trying to do the tracker or trying to look at it and go, what's my net production? Well, your net production is both of those adjustments taking off of production. It's not just one of them. So I don't know why they do it that way, but I'm not going to blame Open Dental. We just got to make the tracker look like it.
I believe in Open Dental, the net production is already subtracted the adjustments and also subtracted the.
Then that's the column. We either look at that and that's all we put in and we don't do any adjustments, or we put the big number in and we put all the adjustments in this adjustment column, not on the production.
When I know you've already said it twice, but it's so fast. I'm sorry.
That's okay.
For the slow guys.
Yeah, that's okay.
Here, production, hygiene production per patient, hygiene production per hour.
Yep.
And doctors.
Yep.
Production per patient, production per hour.
Yep. That's those four numbers. That's the only way to compare apples to apples on any practice. But for you, it's got to be, we got to just get clear on, is it gross? Is it net? What is it? Because we've kind of been doing both here.
Okay. I thought for a second you said, and this for hygiene and maybe not this for doctors, but those four things, great.
For both. And then in hygiene and doctor, I'd want to know how much open time are we dealing with? Because that's lack of case acceptance, people being okay canceling.
Yep.
And then hygiene,
obviously that's clean.
Yep, I like it. And then perio percentage, which is everything's fine with tracking it that way too. So,
all right. So here, one thing, getting ahead of ourselves because I just need to fix these numbers and we'll reevaluate. But when I'm tracking my numbers and a different tracker, I hear you saying that like looks like hygiene, we're just a loss leader. We're just kind of like almost squeaking by with hygiene to make up money later with fillings. Yeah. When I'm running my numbers, we're pretty much like 3-1 in collections for hygiene compared to doctor. Are you seeing the same thing here? It really looks like hygiene is just like, I mean, there's numbers that say like 129 production per patient. I just don't. It must be.
It's not right. It's not right in the tracker. I bet if we run that in Open Dental, it's going to be different. Now, I don't know what's not clear to me is how much of that is net and how much of that is gross. In other words, are we double dipping the adjustment or what? But I mean, if you look at these numbers, you go, awesome, 197 per patient, but we still had to do some write-off on that because of insurance, right? So we'll get better at this in 2023. I think a new tracker is right around the corner for us. And
fresh start.
Well, we'll start over. We'll start in January and we'll just make sure we're consistently doing it all year this way. And let's not put negative production numbers in the provider's daily production column.
So we'll just do back to net production and we'll put that in yearly summary page. Yeah.
Okay.
Okay. Sorry, I'm with you.
All right.
What else are we seeing in this? Because and sorry to interrupt you, but I'm super motivated. Maybe it's because Lynn is here now. If we're looking at our hygiene department.
Yeah.
I mean, once we get accurate numbers, if the numbers still look abysmal, then the next question obviously is like, okay, what do we do?
Lynn, I highlighted 2 columns for you, Lynn. Tell Dr. Gens how you see these 2 columns related.
Okay, so doctor, so the perio percentage, like, our benchmark there would be at least 35% at the minimum. And you have some broken appointments. And I would say that the broken appointments would be related to your perio situation, because if patients are valuing their treatments and they're in perio and get enrolled in your perio program, then they'll value their appointments more and less cancellations that way. Yeah. And if you can look at other trackers, you'll see that the more hygiene perio percentage, your broken appointments go down. It's like inversely proportional.
Exactly. I couldn't have said it better. That's exactly right. It's like inflation and unemployment.
Perfect.
All right. And what she means by other trackers is.
Uh-oh. Uh-oh.
You see it?
Right, right.
When that number goes up, when that column L goes up, the number M goes down. Now they had a nice spike in COVID here in September, and you could see what happened with COVID with them. We can't really control that, but when that number's high, this number's low. And then look at that. This is there's no write-offs in this practice. And look what they're producing per patient hygiene per hour. It's an expensive area where they live. So, but kind of the wrong side of the tracks for an expensive area. So this is a profitable hygiene department. Okay.
It can be done, Doc.
It can be done.
Oh, I hear you. I hear you.
And I don't think we're saying like there's anything wrong. I'm just saying, hey, there's opportunity here. We can. And these aren't really bad numbers, but 26, it's about 10%, right? Yeah, it's about 10%. It's not horrible, but you see a spike right here, and it could only get better if there was a perio program in place. Then you would see. And then maybe you guys have one in place and they're just healthier patients. That could also be the case. I could show you another practice in San Jose where this number is only 11%. Same exact town, but other side of the tracks, 11% perio. And they do everything the same in both practices. Just different clientele. Okay. Anything else you see on there, doctor, that you have questions about or wonders?
No?
Okay.
What about you?
No, I think we've beat the horse. All right. I don't think I think something's missing here on new patients, but I know you have a goal much bigger than that. And so I feel like there's just something missing there on new patient analysis. You would think that as she's putting numbers in here, she would see that, but maybe ask her about that. Yeah. And if this is accurate, that means we went down to 2 referred patients, 8 per doctor per month. So if you have 2 doctors, this should say 16 a month. That's like raving fans. People just love you and they send people to you. It should just be happening organically. Your wife's killing it on the Google side, but this side, for some reason, we're not organically getting them. So we'll probably have a team meeting at some point on how to really be purposeful about getting referrals without sounding desperate. Do you guys do that already? Do you already know how to ask for referrals and do that thing?
As a team, absolutely not.
Okay.
I tried once and just, yeah.
Got it. I'll put it maybe not this meeting, but maybe next meeting, because we're going to focus on cancellations. But yeah. I think we can improve that number. I think we can at least get it to double digits. It's at 5 right now. Well, I'm including November. Let me fix that. It's at 6. So we'll get it. We'll get there. Okay. Let me just double check with your baby schedule. We've got a team meeting November 15th. Sorry, that's coming up. We got that one. The December 13th team meeting. You and I are meeting December 14th. You're planning on us meeting, but you'll have a baby at that point. Is that okay?
On December 14th. Yeah.
Okay. All right.
Might have less to talk about, but
yeah.
That's
and
great.
Now you've got Evan. Do you know if you're having a boy or a girl?
Boy.
And you already have a name?
All right. No one knows this, guys. Is this being recorded?
Hey.
All right.
We picked out the name a while ago. The name is Wesley.
Wesley, I love it.
We picked out the name a while ago. So, and then Dr. Bao, her husband's name is Jones. And so they went back and forth. Really tough name because every name you pair with Jones is already a football player. So they really were struggling. And so Dr. Bao had a boy a couple weeks ago, Wesley. Yep. And when they announced it, I was in the office and I go, no. And they're like, oh, Dr. Gens, what's the matter? Oh, no, I got you. No, I'm good.
But you're going to stick with it, right?
Yeah, definitely. So my wife insisted, you have to call Sarah. You have to ask her permission to use the name. Yeah, okay.
You thought about it first.
Yeah, and it's not like you guys are like family. You're work. I mean, yeah.
When I knew she was struggling, we should have staked our claim.
You should have. Have you seen that Friends episode? You ever seen that one?
No.
Oh, yeah, Monica. Yeah, Monica's got names picked out, and Rachel steals it. I love that name, and she gives her the name. Yeah. Okay. Just quickly, on my doctor checklist meetings, employee retention credit. Have you already applied for that and gotten that going and everything?
We didn't use that.
Okay.
Employee retention credit.
Would you like to do that?
With our accountant who is really up on this, you needed some benchmark of lost 50% something, and we're not there.
I don't think so.
All right.
I don't want to create any disagreements or like I have one doctor who goes, I don't want anything coming to me from the government. I said, okay, that's totally fine. I have a doctor, 16 members. He got 199. I have another doctor has 16 members, got 70. So, wow. And they didn't even do anything different. There was a rule that in quarter two, you had to have 50% quarter two versus the year before, you had to have less collections or whatever.
That big jump is like 50% or something.
Yeah, I'm not seeing that being an issue with clients. I don't do any of it. It's over my head. So if your accountant's saying no, we're going to trust your accountant.
Okay. If
you get to a place you're like, Eric, I want a second opinion on this, then I'll put you in touch with somebody to give you a second opinion on it who speaks clearer on this if you want that. Yeah, I mean, it could be 100,000, 150,000. I don't know. So I don't want to add that stress to your life. I don't want to tweak anything. Okay.
Well, my guy is a dental CPA, and I'm just like, okay, do what you think. We did not do employee retention. Instead, we did all the other PPP.
Yeah. This should be in addition to that. You really should be in addition to that. You should be getting some money back. I don't know why that is. I'm not a CPA. I can't tell you. So yeah.
I'll ask him. I'm meeting him next week. I'll ask him.
Yeah. And if you don't get anywhere with it and you want to just talk to a second opinion, somebody who's getting the money for clients, just let me know. I get nothing out of it. There's no kickback. There's nothing coming to me at all. Okay. I'm just like, look at it. That's all I'm saying. Okay. All right.
Thank you. Thanks for bringing it up.
Okay. We'll ask CPA again. I'm just really excited when clients are like, I got all this money. I go, awesome. High performance coaching. If we had time, I would get into this some more with you because I think you have the mental capacity and drive and desire to do this. And if you decide next time you want to dive into that some more, we can do that. And it would be taking Ryan into the equation and not Dr. Gens. Okay. And
I like that.
It would be family freedom, health, finances. We would look at those three and we would create a vision for those three. And I would do some questioning with you on that. And we would figure out where you're going. And I'd help you create accountability to get there. Okay.
All right. How much extra is that?
Nothing. Yeah, that's just us. That's just me getting to have fun with you. I love it. Yeah, I love it.
All that for free?
I can't do that. Yeah, I can't do that with some clients. Now, true high performance coaching is every 10 days you have a call with your coach.
Wow.
So like my coach, his client was just in the World Series and he was happy they won. And he has a call with him on the way to the game. And he has a text message to him in the dugout to follow all the things that the hacks they've put in place to make sure that it's happening the way they've set things up to be. And that's not for everybody. He has, and so anyway, we could do it once a month instead of every 10 days. Yeah. Be bigger gaps between time, but you could text me or we could do some different things to make sure it's happening. Okay. We already have our, yeah, go ahead.
I'm in.
All right.
Whatever you say, I'm doing.
I'm going to put here next month. Roll with Ryan. Okay. Team meeting coming up. We already know what we're doing there.
Can I follow up with you on 2 things?
Please.
I told you we're kind of easing everyone into the summit.
Oh, yeah. We're waiting for them to get a flavor for this for a while. Yeah.
Right. We met with you, and then every 2 weeks we alternate. I have a housekeeping, and I said, listen, it's a little early. I just want to tell you guys, some people, hygienists already noticed we have blocked off that schedule. What's going on? What's wrong? Okay. It's potentially, tentatively, maybe an all-star thing.
Yeah.
And right away, the hygienist was like, oh, that'd be cool. All right. So I told the whole team. So we're more tentative than we were 2 weeks
We're moving
ago.
in the right direction. I love it. I just got to not blow it.
It's all up to you. Don't blow it, Eric.
I love it. I'm excited. Look, you have exactly the team mentality for what we do, what Lynn will be there, what we do in these programs and what we teach to love it. Cool. I mean, it is just a amplified version of what we just went through for an hour. Yeah. If they love that, they're going to love, it's just a sample size. Yeah. So it'll be amazing. If you guys decide to go, it'll be amazing. I have every confidence.
I think we're in. I'm 99% sure we're in.
Yeah. I think December 31st is the early bird special pricing that Alex put on there. So just watch that date and make sure you go, we're in. And I think that's all you got to say. Okay.
Second thing is way back, Dr. Bao talked about doing coaching.
Yeah.
Now we have we have Dr. Patricia with us.
Yes.
You and I talked about you fundamentally have been taught that they should be paying for it with skin in the game. At some point, we're kind of running to the end of today, but at some point we can talk about this again. And whether I'm paying for 100% of it or 90% or whatever you think is best, you've seen what other offices do.
And you could take it out of their paycheck or something at some percentage if you want to. If it's just going to come on your credit card, it's a write-off for you, and then you take it out of their paycheck. Or you could say, I highly suggest you do this. When you do the high performance coaching next time, you're going to see a whole different aspect of it. But they just want verbal skills training, right? Is that really what it's focused on?
I just want them the opportunity to grow, and associates are worried about rent and loans, and they think another $400 or whatever it is.
Yeah.
I don't know.
Yeah.
My hesitation, I'd pay for it for myself, except I don't want someone to sign in
and not value it.
Mentally not present.
Yeah. Ask them, say, what would you invest in yourself to do one-on-one personal coaching with a coach?
Yeah.
It probably won't be me. Doesn't have to be me. Won't be me probably. And get a number out of it. I'd probably pay $200 a month for that. Okay. I'll take care of the rest. There you go. They got some skin in the game. That's how I would do it. Yeah. Yeah. And then you let us know when you pull a trigger. Let's get her back. Let's get her feeling in her arm, and let's get Dr. Patricia going. And was she at the team meeting?
She was.
Okay, good. So she's not missing anything yet. She just needs some more attention. We can get her with Lynn. We can get her with Karen and Greg Raymond. They're a duo where it's a dentist and an admin person coach. That might be good for a dentist to get one-on-one coaching with them. That might be perfect. Treatment planning. He could talk to him about confidence. He could talk about I think that might be the best fit actually is Dr. Greg Raymond and his wife Karen. They come together. So that'd be perfect. Yeah, 2 coaches for the price of 1, and then you get some other sounding board than just me, and it's $500 a month to add a call. So instead of the $645, so it's a little bit of savings. And yeah, just talk to them about it. Let us know when you're ready. Love it. Love it. I love that you guys are encouraged by it. That makes me feel really good. It helps. Like I said, back to you, this is my why. If you guys are seeing value in it, it's helping, then we're very excited. Okay, so we already have December 14th, you and I. We already have January 5th, you and I. We already have February 15th, you and I. So I think we're good for now. We'll do March maybe next time.
Sounds good to me.
Okay, then we're good. We're good to roll. All right. All right.
Guys, thank you.
Thank you.
Thank you, Doctor, for letting me. Congratulations on the baby.
That's right. Yeah, so happy for you. I want a picture. I want a picture.
Will do.
All right.
Any second now. Any second.
The bags are packed. I love it.
Yeah,
All right.
they are in the car, locked and loaded.